So we know that some of our adult patients who come in needing maxillary expansion have had adult premolars extracted when they were a child. In cases like this, do you recommend replacing those teeth, or what's the best way to usually handle these types of cases?
The reason why those premolars were extracted is because the jaws were too small. The right treatment is to grow the jaws. In the upper jaw, we do that by skeletal expansion of the maxilla. In a lower jaw, we don't have that trick, unfortunately, and it depends on the patient and what that patient needs. But in most cases, for me, it does not make sense to open up the spaces for the implants because we're not growing the jaw at a space where it matters. However, I actually did have one patient where I opened the spaces for premolars because they were extracted without a lot of crowding. So the extraction was the wrong thing to do in the first place. And we're growing the jaw. We're also doing lower jaw surgery and we're opening the space for the missing premolars to also get good lip support.
I'll look forward to seeing that case review when it's complete. That sounds like a really interesting case.
It's a long journey. I'm glad that most patients don't need it. And also, if patients read about, I had premolars extracted and I want to open the spaces. So please don't just go to a doctor who just opens the spaces without expanding the maxilla because you're not growing the jaw where it matters. Actually, you're not growing anything really. The chances that you move the remaining teeth out of the bone is really there, and you might get even worse than it's now.
I think it's also important for patients to think, what am I trying to benefit from this treatment? So you have to ask yourself, because for me, for example, I did have four premolars removed for braces. So I had to really ask myself, well, by replacing those teeth, what am I trying to accomplish? Well, I know that I need to breathe better and sleep better, and I don't have enough room in my mouth for my tongue. And I can accomplish all those things without having to replace the teeth. And that it is a much more extensive orthodontic experience. It adds time onto the treatment. It adds expense. You have to put the teeth back in. So I do see, like with myself, I'm very happy with the result that I'm getting without replacing those teeth.
I think a lot of patients are looking into the option of replacing the missing premolars because I think they want to have a wide smile. Probably they don't even know about the breathing and stuff. But Melissa, I think you can testify that you can get the most beautiful wide smile even without
Yes.
making extra space for the premolars.
Yes. I never even knew this was possible to have such a wide smile, and I'm so happy with it.